Good day. To discharge a patient, there are two processes involved. This requires that the doctor must certify an outcome, whether the patient has been discharged satisfactorily, dead, transferred, or otherwise, before the final discharge by the nurses. So, the doctors certify an outcome and then the nurses will do the final discharge. So let's take this for instance. Now, I want to discharge this patient. So first of all, this is what the doctors do first before the nurses will proceed to the final discharge. So select, go to inpatient, and then we select inpatient consultation ward rounds. Then we type the patient folder number. Okay, now let's take this diagnosis for instance, appendicitis. Now, once we want to discharge this patient, we will select the outcome as discharge satisfactory. There are a lot of outcomes here, so you will select one of these outcomes depending on the status of the patient. If the patient has been discharged satisfactory, you select discharge satisfactory. Then let's check whether we entered diagnosis for the patient. Okay, then let's save. Okay, it says sorry. It says sorry. The main diagnosis, appendicitis, must have a fee. Please check the diagnosis well. Okay, let's try and see whether it keeps on telling us must have a fee. Now, if you see this error, all that the system is trying to tell you is that you must request a procedure for the patient. So we will go and request our procedure. Let's say for this patient, a procedure was done for the patient. Let's say now we will enter appendicectomy as a procedure for this patient. Sorry, input the folder number. The clinic will be general surgery and the service place will be adult surgery. By default, this service will be displayed. Just take it off and then type appendicectomy. Select the appendicectomy. You click once it has been saved. Now you can go ahead and then save the discharge. You can go ahead and then save your discharge. Click on it. Because we have done procedure for this patient, that is why the system allowed us type the clinical history or examination. Let's say stable. Sorry. And then discharge. We click on save. Now, once the doctor is able to do this, the nurse can go ahead and then discharge. After the patient has gone for his or her medication, the nurse will come to inpatient and select discharge patient and enter the patient folder number. Click on yes. Now the outcome is here. Anytime the nurses are discharging, they should make sure that the outcome here, they should make sure something is displayed here. This place is filled. If this place is blank, that means the doctor hasn't discharged the patient. Also check the procedure. If the diagnosis requires a procedure, you must enter the procedure before you can discharge the patient. In my case, I have already entered the procedure, so now the system will allow me to discharge. Okay, so just click on discharge, click on yes, and then it discharges or saves it. If for any reason you realize that you've made a mistake and then you need to cancel the discharge, click on find. Then you enter the patient's folder number, set to the date you discharge the patient, and then you click on OK. Now it will load and then bring you back the information you discharged earlier on. Just click on cancel and then click on yes, select yes. Patient has been reassigned bed number 24. Click on OK. Now this patient becomes an inpatient again. After cancelling on the discharge form, go to the inpatient form, and then if you want to enter additional notes on the patient, because you have already selected the outcome discharge, the system will not allow you to save the clinical notes. So click on find, enter the folder number, select the dates and select OK. Select discharge from the list displayed here. OK. Then since we want to enter additional information on the patient, we'll select the outcome, stay on admission again, to overwrite the previous discharge so that we'll be able to write additional notes for the patient. Then you click on save. Then the patient becomes an inpatient again. After doing all that you have to do for the patient, then you can go through the normal process of discharge and then discharge the patient finally. Thank you very much for watching this video. Please subscribe to the channel for more videos. Please subscribe to the channel for more videos. Thank you.